Yes. Today's numbers shows us an important increase of cases, but our health network is ready to face it. The most important thing is to follow the public health directives. If someone still thought it wasn't serious, it's time to wake up. Non-essential businesses must close and gatherings must stop. If they don't, police will distribute fines and force people into isolation. It's a question of life or death. So everybody must continue to follow our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances, and when you come back home, wash your hands. It's quite simple. If everybody follow those rules, we'll save lives, and I'll thank you all.
Good afternoon. Premier Legault, you said first that police officers were there to inform the population. You didn't want to create social tensions, and you didn't want the army to intervene. But now the tone has changed.
Yeah.
What forced you today to say to police officers, please be more severe, more strict?
First, I receive more and more messages from the population saying, hey, you're asking me a lot. I respect your directives, but some don't. So what will you do something? So I think it becomes important that the police, that they give fines, and it's important fines. We talk between $1,000 to $6,000, and I think we're at this step now. We need to be sure that everybody collaborate, everybody respect the directives. I think it's important, and it's important also for the spirit of all the population. We have to work, all of us, together. And if few people are wrong, we have to see some consequences.
Second question.
Mrs. McCann, you talked about CHSLD's workers or orderlies that, for example, we have a case in the Mauricie that CHSLD's employees were called back before their 14-day isolation was up because there weren't enough workers. So then you talked about the 7 days, that they could be back after 7 days when it was necessary. But how solid are you knowing that it's possible when you are asymptomatic to pass on the virus? Isn't it risky for you to know that they are back after 7 days and they're working with seniors, vulnerable people?
Well, it's first of all, it's orientations from the public health, the Institute of Public Health, that has examined all the questions. We didn't decide that, without this advice, this scientific advice based on data. And we're taking all the precautions. I mean, the temperature is taken twice a day. The person is wearing a mask, and they're washing their hands constantly. So we're taking all the precaution, but this is, it's very exceptional, as I said, but between leaving people all by themselves without services, we cannot do that. We have to take the path that is the less risky for the person, and at this point, it's working out. But, we don't know what is going to happen tomorrow in this situation, but we have taken all the precaution. And as I said, all those measures are taken every day with the staff that are coming back after 7 days.
Samuel Pouliot, CTV News.
Good afternoon. Mrs. McCann, we now have seen an outbreak of at the Verdun Hospital. Is that symptomatic of the lack of protective equipment for healthcare workers there at the Verdun Hospital?
Well, I think we have to see what the Public Health Department says about the investigation at Verdun Hospital, but I think now it's under control. All the measures have been taken, And I know very well Verdun Hospital because I was a manager. I was the director general there. And I know the staff and I know the director general. And I've spoken with her recently. And the situation is under control. And all the precautions have been taken, the isolation. And that's what is important.
Okay. Good question. And we are getting calls, and we've done interviews with different companies and doctors who have developed ventilators or masks or even online triage tools. They are not getting any response from the government. Is there a problem? How the government is handling that?
We have a team of about 200 people working on that. Of course, they're going further in their investigation depending of the seriousness of those people. Sometimes, I give you an example, people, they say, I'm ready to make some mask, but I don't have any material, I don't have any design, I have nothing, I only have people that are ready to work. It's nice from these people to offer their help, but we're trying to be closer to have people that will be able to deliver the material in the next few weeks.
Thank you. Yes. Yes. So, question sent by email now from Phil Autier, Montreal Gazette, for Premier Legault. What measures is Quebec taking to ensure protective masks are making it from a supplier to Quebec? Are you sending planes? Are there police on these planes?
We use police force. We use also the relationship we have in different countries. So we do all what is necessary to be done to make sure that the equipment is going to the hospital.
And now for Mr. Arruda, we are seeing thousands of people waiting for test results. Are the numbers of cases and deaths you're reporting today an accurate reflection of how widespread the coronavirus is?
Yes, I would say for deaths it's clear. For cases, there was a backlog, but now that it's getting out. So and then we're going to be able to give, I would say, the right data. And in fact, there was probably cases that was announced yesterday that was supposed to be announced before if they get tested at that time. But we are correcting that. And so I think that if there is a people who dies from coronavirus, even with our case definition where sometimes we don't need to have a test, it's clear that the deaths and hospitalizations are the right ones.
And now a question from Raquel Fletcher, Global News. Are you concerned about getting the medical supplies we need given the worsening situation in the United States and the growing need in that country?
Okay, I think that all countries right now are worried about getting all the material. I think we are in a better position than many states in the United States. We still have for 7 days, and we have enough ventilators to go through the peak. So we are in a, it's not an ideal situation, but it's a best situation than many other states.
One very last question. The mayor of Oka says too many people are driving through his community in Saint Placide to access the smoke and marijuana shops in Kanesatake. He's asking for road checks to be put in place. Is it a concern for you? Should these shops be closed too?
Yeah, they must be closed, and I thought they were closed, so I'll check that.
All right, so that's all the time we have. C'est tout le temps que nous avons. Merci beaucoup tout le monde.
Merci tout le monde.
Et à demain.
Bon jeudi.